morning. My name is Jennifer. I'm going to be your nurse today. Can you tell me your name? Okay, Carolyn or Miss Forward, what do you prefer to be called? Carrie? Okay. I'm just checking your wristband. Can you tell me your birth date? Very good, very good. So Carrie, I'm going to do a full assessment on you. What that means is I'm just going to look you over from head to toe so I can get a complete picture of how you're doing today. I'll ask you some questions. You're going to feel my hands. I'm going to listen to some things. I'm going to listen to the front of you and the back of you. It will be quick. Max amount of time should be about 10 minutes, and we're just going to do everything. Is that okay with you? Awesome. So Carrie, can you tell me what day it is? Great. Do you know where you are right now? Okay, very good. I'm going to ask you, can you squeeze my hands real tight? Very good, very good. And now with your feet, can you pull back on my feet? Good. Can you push forward? Good. While I'm down here, I'm just going to listen to feel your pulses. Nice and strong. Also, while I'm down here, I'm going to look at your legs to see if there's any swelling. I'm going to push in pretty tight here. Good. We don't have any edema, which is that swelling. All right. I am going to shine a really bright light in your eyes. It'll just be real quick. I just want to look at your pupils. Good. I'm going to do the other side. Good. Your eyes are beautiful. All right. While I have my light, I'm just going to look inside your mouth. Make sure we don't have any white patches. Make sure there aren't any growths. All right. Perfect. Excuse me. Okay, I'm just going to do the same thing that I did on your feet, and I'm going to feel your pulses here. While I'm at it, Carrie. Good. Have you had any dizziness or any trouble walking? Have you stumbled or fallen recently? Good, I am glad to hear it. Can you smile for me, really big? I'm just going to count the teeth, make sure that they're the same on both sides. Good. Now, can you stick out your tongue? Straight out, straight out. Good. It's right in the middle. And your face looks really symmetrical. I don't see any drooping. Your eyelids look good. All right, Carrie, I'm actually just going to listen to your neck. I want to listen to see if there's any kind of turbulence here. I want to make sure that your blood flow to your brain is good. And then while I'm at it, I'm also going to sit you up pretty high here. I just want to look at the veins in your neck just to make sure that they are not too full or distended. Good. Now I'm going to listen to your chest. And I'm just going to count down real quick. I'm looking for the little space between your ribs, about 5 spaces down. I'm just going to listen here for a minute. And Carrie, it looks like that you're breathing nice and easy and regular. Do you have any trouble breathing? Good. Do you have any cough? Or are you bringing anything up if you cough, especially in the morning? Okay. Now, I was counting your respirations when I was also listening to your heart. Now I actually want to listen to your lungs. Is that okay? Perfect. Take a deep breath in. And again. Again. And again. And then 2 more here on the front. Good. I'm going to help you sit up a bit. I'm just going to get underneath your back for a moment. A couple real deep breaths. Other side, deep breath. Okay. And again. And again. And one more time. Good.
That was awkward, huh?
All right. So I'm going to listen to your belly. And then I'm going to push on your belly. And then I'm also going to push on your pelvis a bit. And ask you some questions after that point. So everything looks symmetrical. I don't see any big lumps or bumps. And I'm just listening to make sure that your digestion is happening the way it's supposed to. Do you have any trouble moving your bowels? Do you know when the last time you moved your bowels was? Okay. Does it look normal for you, or have you had any diarrhea? Have you had any constipation? Is it hard? Is it black? Good. Your belly's nice and soft. I'm gonna pull this down. I'm gonna push in around your pelvis. And what I'm looking for here is just to make sure that your bladder is not distended. Okay, last thing that I want to check is I want to just take a real quick look over your skin, especially on your backside, and then after that I'm gonna have a bunch of questions for you. So I'm gonna put your head down again. And we are gonna roll you to your right side. I will keep you covered. I just need to see what's happening back here. Are you ready? 1, 2, 3. Good. No redness. Any tenderness back here on your bum? Good. All right, let's get you situated again. I'm sorry, I'm messing up your pretty hair. Straight. All right, so Carrie, I just have a few questions. I noticed that you're wearing oxygen. Do you wear oxygen at home? Okay, do you feel short of breath at all? Do you ever get anxious and you feel like you can't catch your breath? Okay. Do you ever have any chest pain, especially with any kind of activity? Good, good, good. I'm glad to hear that. Do you have any pain at all, anywhere? Good. And then I talked about your bowels. Do you ever have any problems urinating? Does it ever burn? Do you ever feel like you have to get to the bathroom right away? Do you feel like you go to the bathroom a lot, but you only have a little bit of urine come out? All right. Well, thank you very much for that. I will be back in about an hour, but if you need anything, please feel free to hit your call button. Thank you very much.